So 100 years ago, the risk of cancer was 1 in 33 people would get cancer in their lifetime. And today it's 1 in 2. The body actually starts to use the tumor as its fuel, which is flipping the script on cancer. I think it's actually by design that we're not taught about diet, because if we were taught, we would reverse a lot of things without medications, right? But the whole system depends upon physicians prescribing medications. People who I've seen heal without the conventional therapy are doing 4 things.
Well, thanks for doing this. Now, I was a little bit about your background. So you are, I guess, an oncologist. Is that correct?
Yeah. So my background is radiation oncology. I practiced radiation for 20 years.
Okay. That's well, most people, I mean, a lot of people are probably not aware of that particular specialty. It's fairly niche. I remember when I was in medical school, a few people wanted to go into that. And that was a pretty competitive specialty, as I recall, back in the day. But what drove you into that particular specialty?
Oh, into oncology. So I volunteered at hospice as an undergrad. And here, I'm just going to adjust my camera a little bit. And it was life-changing to spend the time around people who were facing a life-threatening illness. And it happened to be that most of the people at that hospice had cancer. And so I ended up applying to medical school, specifically interested in oncology, but not sure. I didn't know that, radiation versus surgery versus medical oncology, but ultimately ended up pursuing radiation oncology.
Yeah, and that has evolved quite a bit over the last several decades, where we've gotten very targeted with radiation, my understanding. I think back, in the early days, it was sort of massive radiation, and obviously a lot of collateral damage was occurring. And then same thing with the chemo in many ways. I mean, it was just kind of like kill everything, and if whatever survives, hopefully the body survives type of stuff. So so I guess now I see you list yourself as an integrative oncologist. So what does that mean?
Sure. So I I left Western medicine in 2022. And then in 2023, I launched my current practice. And it spans a huge spectrum. So I help people who are doing conventional therapy get better results, fewer side effects. So, for example, fasting around chemotherapy can help protect the normal organs and also sensitize the cancer to the treatment. So I help people who are getting conventional therapy, but then I also help people who are not pursuing any of conventional therapy and healing naturally.
All right, that's going to be a very contentious topic, as I'm sure you're aware. So let's just talk about, I guess, the conventional therapy. So and I know it, oncology has a lot of nuance, and depends on the type of cancer and the grade of cancer and the stage and the various characteristics of the cancers. But in general, how is cancer approached in the conventional system?
Well, in the conventional approach, it depends on the type of cancer, right? Because we call like 800 different conditions cancer, right? They all fall under the same diagnosis, but they are all unique entities. And it really depends on the type of cancer, because some types of cancer are very sensitive to systemic therapy, and you might start with systemic therapy, and other ones are less sensitive to that, and you would do surgery. My particular specialty was breast and gynecologic cancer. So that's where I spent most of my career. And it, typically with both of those, you start with surgery, and then depending on the stage, depending on the type of cancer, you may do chemotherapy, hormonal therapy, radiation therapy as well with that.
Yeah. So a debulking, and then chemo radiation to take care of anything that might still survive. And I guess if it's got lymphatic spread or, even further spread, then you've got to obviously treat those as well. Why do you think, so this is an interesting question. Why do you think the different cancers react differently? I mean, it's not a homogenous thing. I mean, obviously you can get skin cancer and live your whole life and never die from skin cancer. You get something like, I don't know. I mean, well, melanoma would be the exception there, but you can get, lung cancer and die quite rapidly and easily from that. What do you think distinguishes the potential treatments for these why do you think it's occurring? I'm just wondering what do you think's going on with the physiology that's making these things more dangerous than others, perhaps?
Well, every type of cancer is arising from the type of cells in that part of the body. And so the cell division, the rate of cell division, the environment that the cancer will grow or not grow in is different depending on the types of cancer. Like, for example, with breast cancer, if you have women who are overweight, right, holding that extra excess weight, is you've got basically more fat that you can then convert, making estrogen in the fat. And so that's a risk factor for breast cancer growth. Or, it just depends on the type of organ and the type of cells that are involved with that cancer, what they're sensitive to. And then now, as cancer therapies have become more targeted, there's like very specific targets that they will use to, target the cancer or slow down the growth, or, block a receptor that may be an area that, for example, with breast cancer and anti-estrogen, using something to block those receptors. So it just really depends on the type of cancer, the approach that's taken.
What do you think? I mean, I know this is a tough one to answer, but what do you think causes cancer? I mean, as far as I mean, there's people that say it's genetic mutations, and we have all this out of control growth based on the DNA being compromised. There's other people that say it's a metabolic issue, like guys like Thomas Seyfried, who you may or may not be familiar with, saying it's a metabolic phenomenon. Where do you lie in that discussion, or do you have a thought on it, or is it too hard to say this is universally applicable to all cancers?
No, well, I mean, absolutely. I think cancer is a metabolic condition. I think that it's multifactorial, though, for sure. We know from all of the data that only 5 to 10% max of cancers are actually genetically related, meaning that they're passed down and someone inherits their risk of a type of cancer. That risk is really pretty low, like 5 to 10%. But, and then 90% of the time when I was practicing in radiation oncology and conventional oncology, we say, we're not sure what the reason is, it's just bad luck, or, you don't have a clear genetic abnormality. But the truth is that we've had an epidemic rise in cancer over the past 100 years. So 100 years ago, the risk of cancer was 1 in 33 people would get cancer in their lifetime. And today it's 1 in 2. There's some data that says it's 1 in 2 in men will get cancer in their lifetime and 1 in 3 in women, but it's moving up with women as well. And this is a problem of our modern lifestyle. And a lot of it has to do with the food that we're eating, our disconnected connection from nature, our inundation with toxins. I would say the problem is twofold. Number one, we have so many toxins in our modern environment, and we're not detoxing ourselves properly. And then number two, we're undernourished in all the ways, both through the proper nutrients that humans should be consuming to, getting outside and spending time in sunlight, which most oncologists would tell you not to do, or, grounding and connecting with nature. All of those things we're designed for, but we're undernourished. So, if you look at the things that have changed over the past 100 years, is that we are living a faster and faster lifestyle, working more, spending more time seated, sedentary in front of blue lights. We've got non-native EMFs. We've got glyphosate in our soils, and we're not getting the nutrients that we're needing. A lot of people, obviously, your listeners are eating well, but most people are not.
I mean, some people might be critical of that assumption that, cancer rates are dramatically rising. We'll say, well, life expectancy back, 1900 was 30, 40 years shorter than what it is today. So people just aren't living long enough to get cancer. Maybe the detection techniques are much better. We're more sophisticated at catching cancers. Despite all that, do you still, I mean, is the trend still going up, or how do you see it? Like over the last 20 years, I see recently people talking about a rise in cancer in younger individuals that's been
Yes.
happening over the last decade or two. What do you think is it just more of the same stuff fueling that, or where do you think is going on with those types of things?
Well, for sure, we're seeing a rise of cancer among young people, increase of 1% per year. If you take colon cancer, people in their 20s, we're seeing a dramatic increase in that. And that's happened over the past 5 years. I think it's a lot of the same stuff. I think that it's the thing that is affecting older people are affecting younger people as well. And, it's hard to say because I think that people are looking for the one thing that is contributing to this rise in cancer, but it's not just cancer, right? We're having rises of all types of chronic conditions, obesity, diabetes, neurodegenerative disease, cancer, all of those go together. And so I think that you just have to look around and see the number of young people. When I first started practicing, so I finished my residency in 2006. Most of my practice was 60-year-old, 70-year-old women with breast or gynecologic cancers. And that was one of the things that really concerned me, was that the rising number of young people who are entering my office. It is not unusual for me to have a day full of 30-year-olds.
Yeah, that's got to be a little disconcerting in that. And so, um, when it comes to non-traditional treatments for cancer, I mean, there's people. I'm going to go down to Mexico and have a witch doctor do stuff. I mean, there's all kinds of craziness out of it. Where do you fall in that, and what are you finding that's actually efficacious, and how efficacious can it be?
Sure. Well, one of the things that has been really effective for in my practice is water fasting, actually. So, of course, changing someone's diet. I think changing someone's diet is the first thing that needs to happen. I think that's the foundation. You have to get that correct. But, I didn't know that water fasting is something that has been used and shown actually to shrink tumors. And it wasn't until it was like the fall of 2023 when I had my first client who did a prolonged water fast of 17 days. And what happens with water fasting is, it takes about 3 days to get into ketosis, depending on how someone was eating before they were started fasting. Then once they get into ketosis, then they start detoxing, which actually is great. If we think of cancer as a problem of potentially being too much toxins in our environment, you're detoxing the body starting about day 3. But what the magic that happens for cancer is around day 6 or day 7, when the body recognizes there's no additional fuel coming in, it prioritizes dysfunctional disease tissue, foreign proteins, as the fuel source, because the body does not want to go after the heart or the brain. It wants to conserve the vital organs. And so it kind of flips the script, and you can have tumors. The body actually starts to use the tumor as its fuel, which is flipping the script on cancer. Typically, we think of cancer as, something that is taking the resources of the body to grow at, the body's expense. But now you're flipping that script. And so I've had basically the first client who did a water fast. She had a brain metastases. She had breast cancer that had spread to her brain, and she had a 2 centimeter brain tumor. And she had something called radiosurgery, which is very high dose radiation that's focused into the tumor bed. And she had that done. And then she also did a water fast like after the radiosurgery. And when she went back in for her post radiosurgery MRI, her neurosurgeon was like, it's not there. He was confused. And she thought, well, isn't that good? Isn't it supposed to be gone? And he's like, yeah, but that's not what happens with radiosurgery. With radiosurgery, you'll get the tumor, it'll increase in size, but it'll be less contrast enhancing. Usually at 3 months, there'll be radiation necrosis or damage around it. And then over time, it'll start to shrink, and then it'll just be scar tissue, but you'll always see something there. And on this particular patient's brain MRI, there was literally nothing there, no radiation necrosis, so no damage from the radiation, and literally no tumor left. And that was the first time for me where it really caught my attention. And then I realized that actually there are centers that do this, right? So True North Center in Northern California does water fasting. They don't do it specifically for cancer, but they have case reports that they've reported of tumors going away. So that for me has been the most fascinating, because it's something that is not going to harm someone. like that if it's monitored, if it's supervised correctly. The real risk associated with water fasting is refeeding. When you start to refeed, it can be quite dangerous. But if you supervise people through a water fast, it's a safe way and actually helps them, gets into ketosis. So basically shuts down the fuel supply for the cancer, is helping them detox. And then, on top of it, this autophagy is a beautiful benefit. So for me, if someone wants to pursue something natural before they were to do some conventional therapy, a water fast like 14 to 30 days could be a really, beautiful way for them to see what their body is capable of doing on its own before conventional therapy.
Yeah, I guess it makes sense to see if it's going to work or not. I mean, I don't know that waiting 14 days is going to make that big of a difference for many people on these things. Do you find that some cancers are more likely to benefit from something like a water fast than others? Is there, like, you can say this is more likely to get a good result here, where this one we're going to need to? I mean, is there ever a situation where you would say that, hey, don't do surgery on this? Because a lot of people want a biopsy. I know, like, Thomas Seyfried is very critical of biopsies. He feels that going in and doing a biopsy, even to get the diagnosis, is potentially deleterious because it can spread, as you know, biopsies can spread the tissues around. So what are your thoughts on that?
Yeah. So this one is hard because as a conventionally trained oncologist, I've taken care of 5,000 patients in my career. So obviously all of those people had biopsies, and there are certain types of cancers that if you biopsy, you can seed the tract, like sarcomas. But this idea that, tumors, biopsying a tumor basically is seeding, and that ultimately is going to be the downfall. I'm just not sure. I don't have enough experience. I mean, I have a lot of experience, right, of people having biopsies, but I don't have enough experience to say I've seen that it does seed, that it does spread it. But I also, in my whole career, is like everyone had a biopsy, so it's hard to say. But I do know, especially in the kind of holistic cancer space, there are a lot of doctors that are very cautious and say that you should avoid a biopsy if you can.
Yeah, fair enough. Do you find that, well, I mean, as a conventionally trained oncologist, how much credence was nutrition were you given about that? I mean, I know there's some literature that says maybe a plant-based diet might be better for people who are going through cancer, and I would disagree with that. But I mean, how much emphasis was placed on nutrition within cancer treatment? I mean, I know they're worried about cancer cachexia, so they tell people just eat as much as they can sometimes. What's the conventional thought around nutrition? Hey folks, it's Dr. ShawnBaker here. Hey, if you or someone you love is suffering from chronic disease and you're tired of just managing symptoms with potions, pills, and procedures, I want you to check out Revero.com. Our team of dedicated professionals is committed to tackling the root cause of your issue and finally getting you healthy. Hurry up, though. Our spaces are filling up very quickly.
Zero. There's zero training, zero emphasis. If we have nutritionists in the clinic and dietitians, but they're focused on maintaining weight, like you described. So people losing weight associated with chemotherapy or radiation. And then the dietitians are really there to help increase calorie intake, but not really looking at nutrition as a therapy, and certainly not talking about cancer as a metabolic condition. We're not taught anything about that in conventional training.
So if someone were to, come in with, I don't know, let's say they've got a breast cancer, pretty common. Breast cancer is really common. And they said, hey, look, I prefer not to have surgery. I prefer not to have, chemo, radiation, whatever might be on the schedule for me. How would you manage that patient?
Well, I think that it depends on a lot of things. I think that the very first thing that I guess I'll say four things that I can say. People who I've seen heal without the conventional therapy are doing four things. Number one, they're calming their nervous system, because people who have cancer oftentimes are very fearful and have a lot of kind of anxiety and just, in a constant state of fight or flight, and your body doesn't heal in that state. So the first thing is really calming the nervous system. And a lot of that is actually through diet. So you said it, and I'll agree with it, that plant-based diet, I do not think is the right diet for people with cancer. And actually, a lot of them, it worsens nervous system hijacking because they're basically really inflamed through eating all of these plants and not getting enough fats, and specifically animal fats. So calming their nervous system, then detoxing on all levels, so physically, emotionally, mentally, and then nourishing, making sure we're getting them eating the right foods, doing the right supplements. I definitely, if someone came and said, I wanted to heal naturally, the very first thing that I would suggest is a water fast as a way to see if you can get things to move, because that's the one natural therapy that I've seen that you can get benefit without doing aggressive therapies. But I would say, paying attention to it and watching to see if things are growing or, changing in a negative way while you're fasting, obviously you would stop that. But if you see things are shrinking and doing well, that would be probably the very first thing. And then the last thing that really is important for people is alignment. So a lot of people, sickness is really multifactorial, and it affects our whole being. And one of the things that when people are really out of alignment in their life, like they're in a job that they hate, or they're in a relationship that is, not healthy for them, these are things that can make us sick. And so helping people, calm their nervous system, detox their body, nourish their body, and then align so that they're aligned in all of those areas. Those are the things that I would be working with someone.
And, let's, again, you got some woman with a, I don't know, 2 centimeter mass in her breast, it looks like it's likely cancerous. She says, hey, I really like to just treat this quote unquote naturally. How long would you anticipate something like that to last for? And I mean, obviously, I assume it would be a lifetime shift. Is that fair to say?
How long would what last for?
Well, a treatment to say that we might resolve this to where we are, quote unquote, maybe cancer free. I mean, I know cancer free is kind of a weird word because I think we all have cancer, a few cancer cells floating around at all times anyway. So maybe we're never truly cancer free if our immune system's working correctly, keeps it from, growing. But how long would someone like that expect to have treatment for, like intensive direct treatment?
Well, I think it all depends, right? Because so say, for example, the person who had the brain tumor and then it went away after the water fast, the changes that we made in terms of her diet and supplements, those are lifelong. Basically, I would recommend someone stay on a low inflammatory metabolic diet for at least 2 years after their cancer has gone away. And then, I think that it's a full lifestyle change. You can't do the same things that you were doing before in order to heal. So these are changes that when my clients make them, they're lifelong changes.
Yeah, fair enough. And so obviously you can't water fast the rest of your life. There's a point where you have to eat. So how do you, and let's talk about refeeding syndrome, because, people can get these huge fluctuations in electrolytes, which can cause cardiac arrhythmias and all kinds of issues. So how do you deal with refeeding, and what do you kind of recommend when you say a low inflammatory diet? What's that mean to you?
Yeah. So for me, in terms of diet, I am not, strict carnivore with my clients. I basically say that I believe that we're meant to be eating meat. There's a reason why we have canines and we have one stomach. We are really designed to primarily eat meat. But many of my people come from this space where they've been told plants, they have to have, plant-based diet and any meat is bad. And so moving people away from that, what I do is have them eating healthy, humanely treated meat with high quality animal fats. But then the plants that I allow are low glycemic, low oxalate, low salicylate, low lectin. So it's a small list of vegetables that I have on there for people. But basically the idea is to have people eating mainly meats and fats, and then a few vegetables, and really thinking about vegetables as more of like cleansers. So with fasting, this is actually the reason why I started water fasting, is because I was like, oh, there's centers where I can send people to go water fast, but they are all plant-based. So the water fasting is obviously water, but then what they feed them going into the water fast and then coming out of the water fast is all plant-based, and specifically a lot of fruit juices. And that is definitely not something that I would recommend for people with cancer. And so the whole reason why I started supervising water fast is so that people who wanted to refeed in a way that is not plant-based had an option to do that. And so the refeeding syndrome, like you described, it's a problem where if you refeed someone too quickly, the secretion of insulin causes these dramatic shifts of electrolytes from extracellular to intracellular, magnesium, phosphorus, sodium, potassium, and it can be catastrophic. So what we do is we work people up really slowly, coming back in. And I have a couple of different refeeding schedules. One has no vegetables in it, and the other one has vegetables. And basically refeeding people in a way that, what's beautiful about water fasting is you're resetting the microbiome, which is a beautiful, clean reset. So then when people come on, if they were to be refed with fruit juices or, a bunch of starches, you're basically feeding all that bad bacteria that you just, got rid of during a water fast. And so basically we bring them back eating from the list that I described, but then also making sure that we're reestablishing their microbiome with homemade sauerkrauts and fermented tonics and kefir, and really focusing on having a healthy gut microbiome, because that's a big part of the healing for them.
Well, one thing I've seen, I can tell you, I've seen some people go through cancer that have been on, say, meat-based or carnivore diets. And what I often hear from not only them, but at least secondhand from their oncologists, is that they tolerated the therapy very, very, very well. They had less side effects. They just seem to not be as bothered by it as other people that get, severe nausea and, maybe sloughing of, GI stuff, hair loss, and all those types of things. Is there something to that? Can the nutrition impact the conventional therapies as well?
Yeah. Well, and I think the data on this is mostly around a ketogenic diet. So there is data around doing a ketogenic diet during chemotherapy, mainly with brain tumors. So glioblastoma multiforme is the one with the most data around ketogenic diet, but showing that, yeah, people tolerate it better. Actually, they have fewer side effects associated with the chemotherapy, and that it sensitizes the tumor for improved outcomes. So that's, specifically with ketogenic diet. Now, the one thing that you run, and this is just like logistic, is that you run into an issue with people getting chemo is the nausea, that kind of thing, that sometimes they just can't do the amount of protein. So what I find is one of the best things to combine with, if you were going to be doing, a carnivore diet with chemotherapy, is fasting around the chemotherapy cycles. So there's data around fasting either 72 hours, so 36 hours before the infusion and 36 hours after, or you could do even, if someone can't fast that long, you could just do fasting the day of. And that really helps them, because the nausea and the side effects associated with the chemo tend to be the problem with eating the right food. But if you have them fast kind of around that, and then coming back on with, eating meat-based, they'll do better than if they try. Sometimes they can get nauseated during the cycle, and then they get an aversion to whatever they were eating. So it's just one of those things where it can be tricky, that I've found that while people are having chemo, you have to be a little bit flexible, because their body is just only going to, tolerate certain things, and then they're going to get nauseated from something they ate. And then you're just, you end up on this thing where you do the best that you can.
Yeah, you get a sort of conditioned taste aversion or something like that, where
Yeah.
if you ate something while you got sick, you don't want to eat it again, and that may not have been related to that. So let me ask. So you said you're in near Portland in Oregon. There, how? I guess what made you leave conventional practice? Because I mean, obviously, I'm sure radiation oncology, you're doing well. There's no shortage of patients. You probably could have practiced that the rest of your life. Was there something? Was there some moment where you said, "Look, I'm this isn't right for me"?
Sure. Well, starting in 2018, I was also, in addition to practicing as a radiation oncologist, I ran end-to-end cancer care for a large healthcare organization, and so was in charge of everything from prevention to diagnosis through, treatment, end of life, survivorship. And in 2018, I heard a parable at a meditation retreat, and it goes something like this: that once upon a time there was a village perched along the side of a river. And one day the villagers noticed a person drowning in the river. So they sent a villager out to rescue them. And then the next day there were two people drowning. So they sent two villagers out to rescue them. And the next day there were four, and then 8 and 16, and so on and so on. And the numbers were doubling every day. And the village elders praised the villagers because the villagers organized themselves, and they had these elaborate rescue systems, and they were rescue teams and pulleys and all of this elaborate, ways to rescue people off the river. And the village elders praised the villagers. And I remember being at that retreat with one of my colleagues who's a GYN oncologist. And I just turned to her and I said, this is us. Like, we are glorified rescue workers on the river. And like, what is going on? Why are more and more people coming into our offices younger and younger and sicker? Like, we're just getting sicker as a society. And by the way, we don't really know what's happening upstream, because we're telling them, yeah, 5% of the time it's genetic, but 90 to 95% of the time we don't know what's causing this. And that was the first point where my antenna was raised, and I was like, something is not right here. But you're in the system and you don't know exactly what's happening. And then over the next 2 years, I kept having this, just the best way I describe it is a voice telling me that you're not supposed to be doing this anymore, like that you're not meant to be practicing radiation oncology anymore. And it wasn't until the fall of 2020, I had just actually finished, I had been nominated to become the medical director for all of cancer care for one of a large HMO within the US, and had gone through like a 5-month interview process. And it came down to me and one other woman, and the other woman ended up getting it. And I was like, I know I meant to build something, but I just don't think that it's in the system when that happened. And then the next week, I had something that's very similar to a near-death experience, but it's called a shared death experience. And it happens to oftentimes doctors or healthcare professionals who are at the scene where someone dies. And the healthcare professional has that metaphysical experience of the light and the love, and it changes you. And that happened to me in the fall of 2020. And after that event, I knew that this kind of inkling that I had that I wasn't supposed to be doing this anymore was correct. And I also knew that if I didn't leave Western medicine, that I would regret it for the rest of my life, because I'd spent enough time around people dying that I knew the biggest regret was when people would say, I wish I had the courage to do what was in my heart and to do what was true. And so I knew that I wasn't going to be that person at the end of my life, and ultimately ended up having to leave Western medicine and really chart my own course to figure out what is healing, because I do not think that we have it correct in Western medicine about what cancer is. And the problem is just growing and growing, and we're not getting a handle on it. Younger people are getting cancer. Yes, people are living for longer, but we're bankrupting the system with all of these very expensive medications. And if we can get ahead of that, and if we can teach people why we're getting sick and help people get healthy before they have cancer, that to me is the ultimate.
Yeah, when you talk about expense, it's my understanding that some of the most revenue generating specialties in a hospital are often the oncology infusion departments. I mean, these drugs, these make a lot of money for the hospital. I was in a very revenue intense, especially as an orthopedic surgeon. All my procedures were making a lot of money for the hospital, and that was when I decided that, hey, I wanted to focus on lifestyle, it became very painfully obvious to me that that was not something they were interested in. They were much interested in my revenue generating side of things. And so as you, make that transition, I mean, and there's not a lot of radiation oncology. It's not like a common field like general practitioners, like family practice. So there's not a lot of them. Was there a lot of pushback from you leaving, or how did that go?
Well, The hard part was that my husband at the time was not, he didn't understand it. He was like, you trained until you were 32. You make a lot of money. You are helping people with cancer. Like, you're good at your job. Your clients, your patients love you. Your colleagues love you. Why would you do this? And maybe something's wrong with you if you can't be happy having everything that someone else would want. And so for a while, I internalized that of myself. But ultimately, when I had this shared death experience, I was like, you know what? I'm leaving alone. Like, when I leave this body, when I leave this lifetime, my husband's not coming with me. And so I can't use that as an excuse of why to stay. So that was my biggest obstacle, was that he just didn't, he he would have been okay if I was like, okay, I'm going to leave this and I'm going to go do this. But I was like, no, I need to step out and I need to see things from a more broad perspective so that I can understand what's really going on, because I had been so highly trained in this one area, right, of pathophysiology through allopathic medicine. And I wanted time to study what makes the body well. So for me, my biggest, fallout was really related to my marriage, but my colleagues were very supportive. Because I had been in this leadership position, the chief of radiation oncology where I worked was like, you don't want to practice radiation, whatever, we'll do whatever to keep you. And so we worked for a while trying to create a business case, but as I'm sure you're aware, these things, diet, supplements, water, is not going to generate very much money. So from a business perspective, it wasn't something that made sense for the organization, even though my colleagues were very supportive and wanted me to be able to stay. But ultimately, it was clear that I needed to pursue this outside of the Western paradigm.
Yeah, let me ask you about just from your aspect. I mean, it's always nice to talk about the patients and the patient care and how that might improve their side. But I find, and I've talked to a lot of people, like with our company, Revero, we have a lot of physicians that work with us. They are genuinely a lot happier. They feel like their soul feels better because they're actually helping people in a way they never could before. Because as you mentioned, you're kind of pigeonholed into this very, very narrow treatment paradigm. But when it comes to healing, it's much more than that. It's sleep, it's exercise, it's activity, it's sunlight, it's nutrition, it's stress mitigation, it's all these things which we are not experts in. I mean, we're not trained in it. I mean, we got to figure it out ourselves. So what is your own level of personal satisfaction now that you made that decision? Do you find is it even comparable?
Oh yeah. Well, I would say it's much more gratifying for me to be able to practice on my own terms. I think, you know, the fact that suicide rate amongst physicians is the highest among any profession other than attorneys is telling, right? I think so many of our colleagues feel trapped within the system, and knowing something's wrong, like knowing that we could do better, knowing that we need to focus on these things that are so basic that, by the way, we condition physicians into being the worst about taking care of themselves, right? Because we don't teach them how to eat. We, teach them to stay up all night, to ignore their cues of hunger, of sleep, of, all of those things. Like, I had a baby, and I went back to work 5 days after having a baby, and my residency director celebrated that. Was like, I think we set a record on, like, the shortest maternity leave. And that's just like, we're like the most unhealthy group of physicians because we've just been trained into that, right? And so for me, coming out and practicing this way has been totally life changing, because I know that I can't give anything that I don't have. So I am focusing on getting my sleep, eating correctly, fasting, sauna, all of the things that we all should be doing, I'm able to do, but that's because it's the foundation of my practice. And so I can't teach other people to do something that I don't do. So I would say it's been life-changing.
I like that phraseology. I can't give something that I don't have myself. And I think there's a lot of truth to that, because you have a lot of people that, if they can't figure out their own health, are they really as qualified to help you in your health? And again, yeah, anybody can write a prescription. I mean, we're training, I mean, AI will be doing this. I mean, as you probably are aware, I mean, AI is going to supplant a lot of physician duties, and maybe in some cases supplant the physician entirely. So you have to be able to, walk the walk, so to speak, to be able to talk the talk. Um, you'd mentioned GBM, and I'm sure you saw there's a recent paper came out. I think Seafood was on one of the authors on that, where they looked at 18 of them, and they saw that, of the 6 that were ketogenic, I think 4 out of 6 survived past 3 years, and of the 12 that weren't ketogenic, only 1 out of 12 survived to the 3-year point. And so, again, that's one type of cancer, but if you were to, like just a general recommendation across the board to your former colleagues or current colleagues, how would you say, hey, look, we've got to change the way we approach medicine?
Well, I think to start with, nutrition is foundational, and really starting to teach. And even I know that there's controversy, and some people say, oh, it's, plant-based, and here's the evidence with this, if you look at the China study. But I think that we haven't seen well done studies comparing these, because there's not the kind of money, or the money that's in it is in the food industry, right? So the studies that, basically say that red meat is bad, are looking at, industrialized processed meat, that of course, like the type of meat that you buy in the supermarket is not healthy for us. But I think that starting to teach medical students foundational principles of metabolic health, I think, is a starting point. I think that until we do that, the rest of it is so hard, because it's, even with the other stuff. So my practice is holistic. So we look at emotional trauma, because there is correlation associated with emotional trauma and illness. If you look at the ACE study, we can talk about that. But I find that you can't address the emotional issues until you get the diet right. And so I really feel like we are doing a huge disservice. And I think it's actually by design that we're not taught about diet, because if we were taught, we would reverse a lot of things without medications, right? But the whole system depends upon physicians prescribing medications and keeping the system running. So I don't know if that is ever going to happen, but that would be the first thing that I think we need to be teaching people about nutrition.
Yeah, I certainly wouldn't disagree with that. In fact, much of what I do is based around nutrition, and I see, just about every, and I'll be as bold as to say that I think every single medical condition is impacted by nutrition. I don't think that's a naive statement. I think that's a real true statement, including genetic things. It's really blown me away seeing people with like Ehlers-Danlos syndrome, a genetic connective tissue disorder, suddenly getting better when you change their diet, which, I still don't understand the mechanism, but it happens. And so, do you, so what does your practice look like today? Since I mean, obviously you're in probably before it was, you meet people in a hospital, you zap them with the radiation, and then you see them on their way, and maybe you see them for a few visits as they get multiple things. But do you have longer term relationships with patients now and get to know them a little more?
Well, it's interesting, actually, as a radiation oncologist, you do get to know your patients quite well, and now the courses of radiation are shorter, but I would see my patients weekly for like 6 weeks while they're having radiation, and then maybe every day on the table, depending on what was happening. And then you see them out, like 6 weeks after they finish. My current practice is virtual. So I see people online, and my practice, because I don't prescribe pharmaceuticals and I don't diagnose. So it's actually not done using my medical license. I bring obviously all of my medical experience into my practice, but it's done under a coaching agreement. So I can see people all over the world and help them. But I basically help people. A lot of times it's just like a one-time consult. Like someone needs help making a treatment decision and they want like a third party who's neutral, but who understands, right? So I have that deep conventional background that I can help people understand, okay, this is why they're offering these two different things, and helping them make a decision. So I'll do consults, treatment decision consults, root cause consults, helping people look for what are the potential root causes of their cancer, and then holistic healing. But then if I'm going to work with someone ongoing, I usually work with them in depth for 12 weeks, and they work with my chef and nutritionist. They work with my I have someone who does emotional healing, which is on the subconscious level, because you can make much faster progress with healing past trauma when you work on the subconscious level. But they'll work with my chef, they'll work with the emotional healer and myself over 12 weeks. And then usually when they finish that, then I have basically see them once a month ongoing. So most of my clients who come with me, then they stay, and we're just doing, touch points once a month to like keep them on the right track.
Let me ask you, if like, let's say I was diagnosed with a cancer and I said, hey, does it make sense for me to pursue the conventional treatment, the radiation, the chemo? I mean, what percentage of the time would you say it doesn't make sense versus it does? I mean, obviously I know there's all kinds of cancers out there, but let's just say some of the more typical ones. I'm unlikely, males occasionally get breast cancer, but let's say I'm a male with, I don't know, colon cancer or something like that. That's more plausible. How do you say the conventional treatment is worth it? Quality of life, extension of life, cure rates. How often does that work out that's actually makes sense versus it's just going to, prolong your life a couple months and the quality of life is going to be horrible? I mean, that's got to be a decision point.
Yeah. So, well, and what I always say to people is it totally depends, right, on the type of cancer and then what's been offered. And I think that I don't even know what I would do in any particular scenario. I always say to people, what you want to do is you want to really understand what is the benefit of whatever therapy they're recommending. What are the short-term complications, side effects associated with that treatment? What are the long-term potential complications? And then what would happen if I did nothing at all? And when you can put those side by side and the benefits of the treatments outweigh the potential side effects and risks, I think that's when you decide that you want to move forward. I think the big thing that's hard is that there's this fear and there's this push to push people into treatments really fast. And I get that, actually, as having been in the position that I was in healthcare leadership. There are metrics, right, that the hospitals are judged by, right? So they have metrics that Medicare judges a cancer center by to say, okay, what's the time that it takes from an abnormal imaging to a biopsy, from the biopsy to surgery, from surgery to radiation or chemotherapy or whatever it is, the steps. And so the system, their goal is to get you through this as fast as possible because their metrics say that the sooner you get people, as long as you meet these time constraints, people are going to have better outcomes. But one of the things that I think is really important for people is to understand that that pressure is not real necessarily, that they don't have to jump in and today start some treatment tomorrow just because the doctors have said this. And, it just happens so fast that the first thing that I tell people is just to slow things down so that when you're making decisions, you're making them from a grounded, informed place. And this is partly why calming the nervous system is the most important thing for people with cancers, because when we are in fear and when we have an activated nervous system, we don't see all the options in the same way that we would if we had more time and a calm nervous system, right? People make decisions like, I never want to have the cancer again, so take off both my breasts. Oh, well, by the way, taking off that other breast actually had no impact on your survival or your risk of getting cancer. It was just something that sounded at the moment like I might as well just take them both off so that I never, have to deal with this again. And that's what I really encourage people is there is always time. It may be, depending on the type of cancer, the time may be a little bit shorter than not, but you always have at least a week to 2 weeks to make these decisions because these are lifelong decisions that you will potentially live with the consequences for the rest of your life.
Yeah, I see some people, they get a cancer and they're like immediately cut it out, like cut it out this immediate second, and that's the thought, and that may or may not be the best decision, depending on, as you said, the situation, the type of cancer, and those types of things. Do you, in your practice, is it almost exclusively oncology? Is it pretty much,
Yeah.
I'm seeing cancer patients day in and day out?
Yeah. I mean, I do now with the fasting, I have some other people because there's a lot of other conditions like autoimmune that can benefit from water fasting as well. So I have other people water fasting, but most of my clientele have cancer.
And are you just, I would assume that you see a lot of the more common cancers, the breast cancers, maybe, I don't know, men prostate cancers. I mean, what does a day look like for you as far as a type of patients you might see?
Yeah, I would say I see a lot of women. So, and I think that's just because of my background and my expertise in breast cancer. But I would say, like it's 80% breast and then maybe like 10% GYN ovarian, endometrial, and then like 10% everything else. But I do see a little bit of everything now. But I would say the majority of my practice is breast cancer. I'm seeing more and more colorectal cancer, which is interesting, especially young women with colorectal cancer, which has been surprising. But yeah.
Let me. This is a little bit off topic, but you might have a thought on this. Mammography recently has been sort of called into question. Is it actually more detrimental than it is beneficial? That is to say, more women are actually injured or have improper procedures based on mammography. Do you have any thoughts on that?
Yeah. Well, I think that, this, whenever you're talking about population medicine, which basically screening falls into that category because you're saying you're going to screen a whole population so that you can catch some cancers early, understanding that there's risks associated with the screening. And, Switzerland, this was like now, I think over a year ago, that Switzerland basically was not recommending screening mammograms anymore. And there's always been actually disagreement between the different organizations that make these recommendations. But what I would say is the risk associated with routine screening is you're basically exposing women to that radiation. And whenever you're going to expose a group of women to radiation, there's going to be so many radiation induced cancers because radiation does increase the risk of cancer. So there's that risk. But the argument in the US has been that the benefits outweigh the risks, that having an early diagnosis, that women are doing better when they're diagnosed with cancer. And so if you can catch it earlier, you are going to, change the trajectory. But there's this other piece too of like, false positives, right? Where you have something and then someone ends up getting a biopsy. And this brings up the question of, the experts were saying we shouldn't be doing any biopsies. And guess what? Actually, you're at a higher risk of having a cancer later on if you've ever had a biopsy in that breast, right? So when you start doing mammograms and then all MRIs, some women end up getting MRIs. They're really sensitive and you can see things that are not necessarily cancer that we then cause a lot of undue stress for women, and then also unnecessary procedures for something that may not be cancer. But I think this is still one of those questions that is, I think will always be a question. But I think it's really important for women to talk to their doctor about the risks and benefits and whether they should be doing it every other year or every year, and depending on their age. So and recently I feel like things have shifted again, but it used to be that age 40, testing every other year and then going to yearly mammograms when they're 50. But now it's really having a conversation with your doctor so that you understand what is the potential benefit and what are the potential downsides. And there was a study that was done, it was published in the fall, I think, about women's preferences, that when women were really educated by their doctors about the risks and benefits of the mammograms, many of them opted out for not doing the regular screening and doing it at kind of longer intervals. That was the test in that study, was looking at would women choose a longer interval or shorter interval with adequate counseling. And it turns out that women request less screening when they're adequately counseled.
Now, this next question I know is not, it's not, you can't say with 100% certainty, but how would you say, what sort of lifestyle interventions, because these are things that you can modify. You can't modify your genetics or your sex or age or anything like that, but things that would make me less likely to get cancer. What are the things that I would want to do, or conditions I'd want to be, not have?
Eliminating sugar, eliminating processed foods, um, spending time outside in the sun, not wearing sunscreen. I think that we are really deficient in vitamin D, and vitamin D is correlated with higher incidence of cancer. So um, the whole push around sunscreen and then sunglasses, all of those things, like our bodies are designed to actually be in the sun and respond to the sun. And you have to be careful, obviously, depending on where you live. But as long as you're not burning in the sun, we are really designed to be getting more sun than we're getting. And actually, the risk of skin cancer has increased astronomically since we've introduced skin sunscreens. So those are some of the. Sleeping is really important, making sure people are getting adequate sleep. Stress, reducing stress, and making sure you're moving every day. I think that it's simple, but it's not easy, right? So these are the things that we know we should be doing. I think also eating out less. So the seed oils and the glyphosate and, so many things that you can't control when you're eating out, I think makes a big difference. I think that there's a lot of, people eating takeout and processed foods. All of that, I think, is a big contributor as well.
Let me just, on one point, you said sugar, and there are people that would push back on that pretty hard. I mean, there's people now consuming a sugar diet. They call it a sugar diet, where they lose weight, they eat a bunch of sugar, and they actually lose weight. And some people would say, in the absence of overconsumption or obesity, it's a non-factor. Do you think it has an independent effect? And if so, where would you cite as a source for that?
Well, it's inflammatory. So sugar is inflammatory in our body. So, and what I would say is that, I guess sugar in and of itself, it depends on what you're talking about, but I would say generally having high glycemic foods and foods that are high in sugar are inflammatory within our system. And cancer is absolutely a problem of inflammation. And then if you have cancer, if you think about it from a metabolic perspective, and that if cancer is doing fermentation, then basically you're providing fuel for that. So I think more in the sense of, with people who have cancer, absolutely, I would say no sugar, no fructose, low carbohydrate. Whether or not someone who's healthy, yeah, I think that you can eat some sugar, but I would say in general, sugar is inflammatory within our system. And most people who are eating sugar, I wouldn't say that I would need to see that to see, like, how could someone eat a high sugar diet and that be healthy? I would like to know that.
Yeah, well, interesting. I know it's you'll see. I'll probably hear more about it. There's more people that are interested in this sort of diet where they just eat. It's very, very low fat. It's all lots and lots of sugar and pretty modest in protein. They're able to lose weight that way, which I think can make sense. But well, unfortunately, we're just about out of time here, Dr. Deming. Share with us, if you don't mind, website, if somebody wanted to book a consultation with you or find out more about what you do. Where do they go?
Sure. So my website's katiedeming.com. I have a podcast called Born to Heal, and I'm also on Instagram at KatieDemingMD.
All right. Well, awesome. Well, thanks for doing this.
Thank you for having me. It was my pleasure.